Wade.
Andrew,
How
nice
are
to
you?
meet you.
Nice to meet you too. So this is it.
This is Penhorn Animal Hospital. So this is our reception area. So, you know, when someone comes in, they're greeted by a reception, and we usually get a wait on them as soon as they come in, and then we try to time it so that they're not waiting for an extended period of time.
How did you get into doing this? You're a vet tech, right?
I'm a technician, yeah.
And so what was the moment that said, this is the career?
Well, I kind of bounced around trying to figure things out for quite a number of years, and then I guess I was getting close to 30, and I was living in Toronto, but I was visiting my family in Truro, and we were walking down Prince Street one night, a group of friends, and we saw a cat get hit by a car, and trying to find someone to look after that cat, we couldn't find anyone. So that was kind of the point where I went, you know, I've always had animals growing up and thought I'd like to do something that helps animals, and vet tech was where I went, and that's where I've been since.
And you were one of the owners of this place too, weren't you?
Yeah.
Did you ever predict that would happen?
No, never thought I would own a clinic, but yeah. So when Kathy, Karen, and I were all working emergency medicine together, one of the things during the pandemic, we noticed, you know, people were waiting in the parking lot for, 12 hours for things like urinary tract infections that, weren't an emergency, but
they had nowhere else to go.
Also needed to be seen, and they had nowhere else to go. So we thought, there really should be something kind of in between emergency and, general practice. So that's where the idea for this clinic came from.
Urgent care veterinary medicine. It's a relatively new concept, at least in terms of animals. This clinic, the Penhorn Animal Hospital, is centered on that concept. Its goal is filling the gap between the ever-busy emergency vet hospital and traditional vet clinics. So you were at the emergency clinic before this?
For 25 years.
A long time. And you saw a need.
Yes.
That is being unmet.
Yes, yeah,
So
definitely.
tell me about that.
Well, I think mostly through COVID, when we knew we needed more vets anyway. There's a global shortage of vets right now. But through COVID, we could see people at the emergency clinic that were there because their pets needed care, but they didn't need it right away. And we were, triage 1, so we were seeing the hit by cars, the, can't breathe, that kind of stuff. And so those people would have to sit in the parking lot for, 10 hours, sometimes overnight, to be seen. And so we thought there's, even in human medicine now, they have urgent care, right?
This seems almost like the exact problem we're having in the emergency rooms for humans.
Yeah, exactly. And I think in Cape Breton, they might have just opened an urgent care clinic. So we thought, it's kind of bridging the gap between emergency medicine and GP kind of thing. So we see things that need to be seen in a timely fashion, but they don't need to go over and sit in the parking lot. So we have day of appointments, next day appointments, week of appointments, and we help other clinics in the city too, because they're overwhelmed. So if they're booking out months in advance, sometimes they'll send their patients to us to be seen this week instead of 3 weeks from now, and then we send them back.
The difference between urgent care and emergency is that you're in a life-threatening situation and you need help immediately. Urgent care is that you shouldn't wait and maybe you don't feel good, but it's not life-threatening. And what we were finding is that a lot of animals had a painful ear infection, or they were throwing up, or they were having troubles, and they weren't emergent in that they were not going to survive, but that they were suffering and they needed that care sooner. So where Dr. Lamy and I spent so many years in emergency medicine, urgent care is really something that we're interested in.
I would say that there's been a huge change in what general practice has been in the last 5 years. So when I started 20 years ago, the emergency hospital was open on evenings, weekends, holidays.
Yep.
And so we were doing, anything, your booked appointments, what came through the door. And as time has changed and we've had extra emergency hospitals, more 24-hour hospitals, and then the shortage of vets sort of with COVID and everything else, I think the shift in general practice started to be more booked appointments, less urgent care. So I have a bit of a background that's, I think, beneficial to me because I remember what the old days were like. So when they first approached me here about coming on as an addition, I thought, well, what does a GP vet have to offer an urgent care clinic? But it turns out a lot. But it's been a great shift. I really enjoy it. From the really mundane of just we can get you in the same day or the next day, where home bases now are so overrun and so bogged down, and I know what it's like on the other side of that curtain. You know, you call in and it's we'll see you in 3 or 4 days, or we'll see you in 3 or 4 weeks. We can usually get you in a very reasonable time, but the other thing we do is, even though the demand is high for vets, we book a really nice amount of time here. We can give you a quality experience that I don't think you get the luxury of having sometimes in a general practice. We really take a lot of time. We spend a lot of time with our patients and our clients. This team is amazing. You've got the benefit of people who have been in emergency and trauma medicine, general practice, working with exotics, and all of us come together, and when veterinary medicine is a team sport, that's what it is. So you get this amazing melting pot of all of us, and I don't think that can be matched anywhere, and certainly nowhere that I've been part of or privy to. And it's a really amazing experience being at this hospital.
4.5 kilograms. Can you?
Yeah, 4.5.
This is her favorite cat.
No, I was about to say, I was like, Joe Man is the best man ever.
All right, let me have a listen to you. We get feedback from clients is that they get dedicated care. So we do 40-minute to an hour-long appointments. I don't know what regular practice, but some do 30. So they have to really just get them in and out, and it can't be complicated, whereas we kind of give a little extra time. So if that one that comes in needs an x-ray or some blood work, or maybe it needs a little procedure, that we have time to do that. So I think that's the difference. And we kind of all thrive on it. So, so we're kind of like, yeah, bring it in, we can do it.
I love vomiting cases.
Really?
Because it's very, very tricky. It's you have to really think, and I love that. Yeah, dogs and cats vomiting. Yeah.
Because I guess you can't ask the dog or the cat, well, what did you eat, right?
That's right. Yeah, and most things that dogs eat don't show up on an x-ray.
No.
So if a dog
And
eats
they'll eat
a
anything.
cloth or a sock or plastic, you can't take an x-ray and say there's nothing in that dog.
I'm just gonna weigh this little gecko and work out some drug doses for him to make him nice and sleepy, because he's very sick. And sadly, he's going to be euthanized today, so. His owners wanted to make sure he could go with a little bit of dignity, because he's really, really not doing well. He's been sick for quite a while at home, and he's going downhill, even though they were trying to make him feel better. He's a tiny little guy.
Although this is a show about dogs, I'm told that you take not only dogs and cats, but in fact, all kinds of other animals too.
Yeah.
Like it isn't just dogs and cats.
No. And we used to do that as well at Emerge, because if you have a rabbit or a ferret, or we don't see avian anymore because we don't have anybody here that's really skilled enough
And that's
to
a
handle
real
them.
specialty, isn't
It
it?
is, yeah. And you don't want to pretend to offer care that you can't, if you don't know how to take care of a bird, don't offer it. But we see reptiles, because we have a technician who had a little raise. Yeah.
A few of them.
Yeah. So we see those. So we see all kinds of stuff.
So I'm just gonna
Oh, good.
take him out. He's nice and warm. So I'm gonna cover him up, make him comfy. I'm gonna let him hide. And I'm gonna use this tiny little arm muscle, which you can barely even see because he's so little. And I'm gonna give this right in his arm muscle. There, he didn't even notice. Now he's gonna go back and get sleepy. It's okay. It's all right, bud.
They're having renovations done on the house, so there's a contract. So I think it was maybe a contractor's pencil, those thick ones.
Yeah.
And pencils do not have lead in them.
Oh, it's graphite.
It's graphite. You can't even imagine how thought out this was. Like when we first started, we went through books about building hospitals from, the like brick and mortar or in a leasehold like this. And I think what it was that we all have 30 years experience and we knew what kind of flow.
So this is where the magic happens.
Yeah, so this is our main treatment area. This is our pharmacy.
And you picked the colors in here specifically.
We did. So there's an initiative that's called Fear Free. So it's all about making vet visits as little stress as possible. So we went with a color pattern that was from their palette. So these were colors that were deemed to be calming to pets.
The clinic is set up in such a way that it is sort of aiming towards fear-free or low stress. So the cat ward is as far away from the dog ward as we can get it. Step on and help you because she's gonna be like nailing Jello to a tree. So way down here, this is the eraser part of the pencil. So it's like sitting here. So I thought maybe we'd see the graphite part, like the skinny part, but we don't.
We were surprised about how far people are I guess.
But have to travel, I
But
guess.
have to, yeah. Like I didn't quite realize how bad the vet shortage was affecting, other areas of the province as well, that people would drive, 3 or 4 hours for a vet visit. Like I just didn't foresee that.
This clinic serves an important role in the community. But if it weren't for the growing demand for veterinary care, at the same time that the number of veterinarians is declining, it may not have been needed in the same way. So it is worth taking a moment to recognize one of the reasons this trend has occurred, something many of us may not be aware of. Because
Client.
it truly is a shortage of veterinarians now. isn't
Yeah,
there?
it's global. Like there's a problem.
Why is that?
I don't know. I think it's a combination of aging population of veterinarians who are retiring. I think COVID took a lot out of veterinarians because people were stressed, clients were stressed, and there's a whole sort of thing now, a whole movement about not one more vet, which is a kind of brings to light the problem that we have, which is suicide among veterinarians. And I
Because it
don't.
can be emotionally draining.
Sure.
too.
Yep. And I don't think that vet schools are getting the same application rate too. So people may be looking at this profession and going, seeing all the problems that are here, and going, maybe
not
yeah,
me,
maybe
yeah.
I'll be an anesthesiologist instead.
Any caregiving job is a demanding job, and it takes a toll. It takes a piece of you every day, a little bit of you. You don't go into this if you don't love it. You don't go into this if you don't care and you aren't an empathetic person. So you take on the emotions of every case. You worry when you lay in bed at night about, did I miss something? Should I have done something differently? How's that patient doing? We're texting each other when we're not in the clinic. We're checking on patients. There's some wonderful wins and there's some really sad losses in this, and it takes a toll. Then you add to it, really, the world has changed in the last 5 years. I would say it's become harder and harder. Those things are always there. If you're in medicine, that's part of what you go into. It's not black and white. It's not nearly as cut and dry as we would like it to be and as clients would like it to be. There's a lot of wondering and trial and error sometimes because it's not always a clear diagnosis. And so you work and work and work and work really, really hard. And but lately with the shortage of veterinarians, people are frustrated and understandably, trying to get seen someplace. So we take that extra on. And there's been a lot of compassion fatigue in what we do, where when COVID hit and everybody went into shutdown, we never stopped going to work every day. And everything changed for us. And it was closed door and curbside, and we lost that link with the client. And it's very hard to do your job that way. Things took a lot longer. It was very stressful for all of us. We all have families coming to work every day when everyone else was safe at home, if you will. And here we were, but we had to do what we have to do because that's what we do. And I think a lot of us kind of started to burn out, which I think is in some ways why I when I was approached by these guys, I thought, amazing opportunity for me, because I was really starting to feel that burn in general practice. And this allowed me to sort of reset and refresh. And I come in every day with, and these guys are like, you've been here, you hear positivity. There's a lot, we're all here to support each other. And I feel like I did back in my first few years when I was like, I can take on the world. And it's wonderful to feel that again, because it really is, it's getting to be a heavy toll on a lot of us in this profession.
We had a cat come in that has passed at home, and they would like us to take care of her remains, so we are going to do that now. And we have a cold storage where they go until their bodies are picked up to be cremated, and they can choose whether they want them to have their ashes returned at home or whether they are cremated with other cats and dogs.
We're okay.
Good job. Good job, Maddie. Good job. So we'll just do a full AFAST on her? We tried to take some of what we did at Emerge 2 here, but kind of mingle it with general practice. So for 25 years, I didn't do a single vaccine, but now I have people who travel from Cape Breton to get their puppies vaccinated. And they need to do that because the puppies need to be protected. It's not my, it's not my specialty. Now I love puppies. But yeah, we kind of brought in and we set this up so that we could do emergency-like things, but that we can also handle general everyday stuff. So, ear infections, eye infections, things like that. So I'm kind of growing to like that aspect of practice because it wasn't something I did before.
And maybe a bit of variety from what you've done in the past.
You know what? And I've actually grown my compassion back from
really?
coming here. Yeah, because the people that come here are truly, truly appreciative. Like I don't think since we opened this a year ago that I've had one client be mean or rude or demanding. Yeah.
So does that surprise you?
Well, it surprises me because it happens everywhere else, but I think because we're offering a different type of service or care that they're just so happy to have somewhere to go. Yeah. Because her bladder is really small. But I don't see any stones in there. I'm going to try to get at her a different direction.
I wondered how other clinics had reacted to the opening of an urgent care hospital. This is a clinic led by people who were well known, having been integral at the Metro Emergency Clinic for so long. And some of the services provided here are also provided by traditional clinics. The answer? Well, other vets saw this as a much-needed service, filling an important gap.
There's a clinic just down over the hill that way, one over the hill this way, and one over the hill that way. And they literally just, they kind of feed into us and they know that they can send their clients here, we'll take care of them, and then we send the records back and they can take it from there.
With the vet shortage, I think the focus has become more about, just making sure that the pets are cared for in a timely manner. So, if they can't get a patient in, today or tomorrow and it needs to be seen in that time frame, they're happy to have it come to us and get the records, and then, they'll follow up with them and see how it's going from there.
No one wants anybody's pet to be unwell or not get care, and we want to be partners with everyone and work together. And I think that a lot of clinics are very thankful that if they can't take one of their own patients, that they have a place to suggest and that their patient's going to get care. And then maybe another little guy up there. There's probably all kinds of little pockets.
Well, hopefully we can get a good bit of cups out. I know that would be satisfying. Make him feel better.
We had a dog the other day that came in with a Barbie fish hook in its mouth. Interesting things like that. I have seen some weird things that pets have eaten and swallowed, barbecue brushes. We saw a cat that got into super glue that had, I know,
sounds terrible.
yes it was. Didn't eat it, but had it all
thank
on
God.
its, and was stuck to a big piece of paper and plastic. That was, the craziest things happen, right?
It sounds like it belongs in a cartoon.
Well, there's a good amount of what we do that would make a great cartoon.
Like, are there trends? Or?
There's trends. The last few weeks have been porcupine quills. I guess spring and fall are usually kind of the time that we see a lot of porcupine quills. So we are seeing a fair bit of those. There's a lot of torn nails that we get too. So again, not an emergency, but
But painful.
But painful and uncomfortable for the pet. So something that needs to be seen, quickly, because you don't want an animal suck like in pain.
We can get an infection too, I would think.
Yeah, you can. So it's stuff like that, and then, there's always kind of the one-ofs like fish hooks in the mouth and stuff like that.
Can you get quite a little bit of pus back?
2 mils. Am I about in the spot you were, John?
I feel like there's a lot of pitting edema.
Yeah. I think it might have been a little more ventral.
What's the future look like?
I'd like to see, so we have, Karen and I do a lot of urgent care. We have a GP, Dr. Paige Marriott. I don't know if you've met Jen, she's here doing a little casual shift today. I think what we would like to see is to have a dedicated general practice that gets to do the vaccines and the preventative care, and to increase sort of our urgent care side of it. Like to get, this is my favorite room. I like to do surgeries.
Yeah, that's
I don't
already-
do enough of them right now because I'm busy doing the urgent care stuff. So maybe trying to streamline a little bit.
We want to see as many patients as we can help. And at the emergency clinic during the pandemic, with it just being so busy, like having people wait that long in a parking lot kind of goes against what we want. Like, we don't want people and their pets waiting for an extended period of time to get treatment for something that they need treatment for. So we really wanted to be able to set something up where we could see things in a timely manner and help as many people and pets as we can.
At the emergency clinic, there was many life-threatening patients, and so we don't have so many life-threatening cases here, and that's a very nice break that I didn't realize I
That must be an
needed.
emotional
It is, yes, it's a very big emotional toll when 30 or 40% of your day is animals who are very badly hurt. So it's really nice to have some puppies and kittens in the mix, and handling patients that aren't so critical.
I get the sense this still excites you.
It does, especially since kind of starting our own clinic. It's nice to have,
Reinvigorated.
yeah, it's nice to have something that's, your own and kind of modeled in the image that you want it to be. We really wanted a clinic that was the least amount of stress for pets and their owners. Like, we've had a lot of people come in and say how calming it feels here. Certainly if Kathy, Karen, and I could have come up with a plan sooner, it would have been nice to start this earlier.